I want to talk to you today about a heart-related number that a great many older adults never think to check. That's quietly one of the most important numbers for their long-term heart health. And that's all too easy to overlook because it causes no symptoms. Their cholesterol, and in particular the harmful kind, and their overall cardiovascular risk that it feeds into. Now, I've talked before about cholesterol, but today I want to come at it from a particular angle. The fact that so many people simply never check this number, or haven't in years, because they feel fine and it causes no symptoms, when checking it and acting on it is one of the genuinely powerful, quiet things you can do for your heart. Because unlike a pain or a lump, a high harmful cholesterol gives you no warning, silently contributing to the artery clogging behind heart attacks and strokes for years. So the only way to know is to check, and yet it's exactly the kind of silent number people skip. So today I want to explain why this number is so important, why it's so easily overlooked, what checking it involves, what to do with the result, and how it fits into your overall heart risk in partnership with your doctor. And I'll keep this calm and practical because checking and acting on this quiet number is empowering, genuinely protecting your heart. Let me start with why cholesterol is such an important number, even though I've touched on it before, because the silence is the point. As I've discussed, cholesterol is a fatty substance your body needs, but too much of the harmful kind in your blood contributes to atherosclerosis, the gradual buildup of fatty plaques, narrowing your arteries, which is the underlying process behind most heart attacks and strokes. The crucial thing for today is that this process is utterly silent. A high harmful cholesterol causes no symptoms, no pain, no feeling, nothing you can detect, while it quietly contributes to clogging your arteries over years, until perhaps a heart attack or stroke is the first sign anything was wrong. So your cholesterol is an important number precisely because it's a silent contributor to your long-term heart risk that you cannot feel, which means the only way to know whether yours is a problem is to check it. And checking lets you catch and address a silent danger before it causes a crisis. So cholesterol is such an important number because too much of the harmful kind silently contributes to the artery clogging behind heart attacks and strokes, with no symptoms, so the only way to know is to check, making it a powerful but easily overlooked number. So the silent importance of cholesterol is the key. So this number matters precisely because you can't feel it. Let me explain why this number is so easily overlooked, because that's the problem I most want to address. This number, your cholesterol, is so easily overlooked for understandable but mistaken reasons. First, and most importantly, because it causes no symptoms. You feel completely fine with a high cholesterol, so there's nothing to prompt you to check it, unlike a pain that drives you to the doctor, and people naturally don't check for problems they can't feel. Second, people may have had it checked once long ago, and not since, not realizing it can change and should be monitored. Third, people may not understand its importance, or may find the topic confusing, as I've discussed, and so not prioritize it. Fourth, feeling well, people may avoid checkups generally, as I've discussed. And fifth, people may assume that if they felt a problem, they'd know, not grasping that this danger is silent. So this number is so easily overlooked because it causes no symptoms to prompt checking, because people may have checked it only once long ago, because its importance isn't understood, and because feeling well leads people to skip it, all of which let a silent, important risk go unchecked. This is exactly why I want to draw your attention to it. It's a powerful number that's easy to neglect, precisely because it's silent. So the silence and feeling fine are why this number is overlooked. So overcoming the tendency to skip the silent number is the goal. Let me explain what checking this number involves because it's simple and worth demystifying. Checking your cholesterol is simple. It's done with a blood test, often as part of the routine blood test your doctor may do, which measures your cholesterol, including the harmful kind, the protective kind, and other blood fats, giving the panel I've discussed. This is usually a straightforward blood draw, sometimes after fasting, depending on what's being tested, arranged by your doctor. Crucially, as I've discussed, the result isn't judged in isolation, but interpreted by your doctor as part of your overall cardiovascular risk, considering your cholesterol, along with your blood pressure, age, smoking, diabetes, family history, and other factors, to assess your overall risk and decide what, if anything, to do. So checking your cholesterol simply involves a blood test, often part of routine bloods, that measures the panel, which your doctor then interprets as part of your overall cardiovascular risk. It's an easy thing to have done, and your doctor can arrange it and tell you when and how often it's appropriate for you. So checking this number is a simple blood test, interpreted by your doctor within your overall risk, easily arranged, so checking it is simple and worth doing. So demystifying the simple check encourages doing it. Let me explain what to do with the result, because checking only helps if you act on it. Once your cholesterol is checked and your doctor has interpreted it within your overall cardiovascular risk, the value comes from acting on it. If your harmful cholesterol or overall risk is higher than it should be, much can be done. As I've discussed, lifestyle measures, the heart-healthy, artery-protecting diet, regular activity, a healthy weight, and not smoking, genuinely improve cholesterol and reduce risk. And, where appropriate for your risk, cholesterol-lowering medication like statins, which have well-established benefits for appropriate higher-risk people, can be discussed with your doctor. The point is that a silent, important risk, once revealed by checking, can be addressed before it causes a heart attack or stroke, which is the whole value of checking. If your result and risk are favourable, that's reassuring, and you continue your healthy habits and check again as advised. So acting on the result through lifestyle and, where appropriate, medication, in partnership with your doctor, is what turns checking this number into genuine heart protection, catching and addressing a silent risk before it causes a crisis. So check the number and then act on it with your doctor, since that's what protects your heart. So acting on the result is what delivers the protection. So checking plus acting is the whole point. Let me explain why this all matters so much. Because it's one of the quiet, powerful things you can do for your heart. Checking and acting on this number matters because high harmful cholesterol is a silent but significant contributor to the artery disease behind most heart attacks and strokes, so checking it reveals a danger you couldn't otherwise know about. And acting on it, through lifestyle and, where appropriate, medication, genuinely reduces your risk of those devastating events, which is one of the well-established, powerful protections in heart care. And it matters because the alternative, never checking, lets the silent risk build unchecked, possibly until a preventable crisis. So checking and acting on your cholesterol is a quiet, powerful, evidence-based way to protect your heart, precisely because it catches and addresses a silent danger that would otherwise go unknown. This is exactly why I wanted to highlight this number that so many people never check. It's one of the genuinely impactful, quiet things you can do for your long-term heart health, easy to overlook but powerful to address. So checking and acting on this number is a quiet, powerful way to protect your heart from silent danger. So this number is worth checking because acting on it genuinely protects you. Let me be clear about how to approach this with your doctor, because that's how to make it count. Your doctor checks and interprets your cholesterol within your overall risk and advises on what to do, so approach it as a partnership. So have your cholesterol checked as your doctor advises, rather than neglecting it because you feel fine, and ask when and how often is appropriate for you. Ask your doctor what your cholesterol and overall cardiovascular risk are and what they mean so you understand your situation. Discuss what to do about any raised risk, lifestyle, and, where appropriate, medication, and follow through. If prescribed cholesterol medication, take it consistently and never stop it on your own, bringing any concerns to your doctor, as I've discussed. Support your cholesterol and heart with healthy living regardless, and keep up the recommended monitoring. So approach this number by having it checked as advised, understanding it and your overall risk, acting on any raised risk through lifestyle and medication, taking any medication consistently, and keeping up monitoring, all in partnership with your doctor. So partnering with your doctor to check, understand, and act on this number is how to make it count. So make the silent number count through partnership with your doctor. Let me paint you a picture of how checking this number helps. Picture a man in his 70s who feels perfectly well, and so has never given his cholesterol much thought, having perhaps had it checked once years ago, not since, reasoning that since he feels fine, there's nothing to check. In the overlooked version, his harmful cholesterol is high, silently contributing to clogging his arteries year after year without his knowing, until one day it contributes to a heart attack that might have been prevented, the unchecked silent number having let the danger build. Now picture him understanding the value of this quiet number. He realizes that high cholesterol is silent, and the only way to know is to check, so he has it checked. And his doctor finds his harmful cholesterol high and, considering his overall risk, recommends action. He improves his diet, becomes more active, and, as his risk warrants, takes a cholesterol-lowering medication, all of which bring his risk down, addressing a silent danger before it caused a crisis. The same man, but checking and acting on this quiet number rather than overlooking it because he felt fine, genuinely protected his heart. That contrast is exactly why this number, that so many people never check, is worth checking. So checking and acting on the silent number protected his heart. And let me speak directly to those of you caring for or close to an older person, because this quiet number is so easily overlooked and you can help. Understand that high harmful cholesterol is a silent but significant contributor to the artery disease behind heart attacks and strokes causing no symptoms, so the only way to know is to check. Yet it's exactly the kind of number people skip because they feel fine. You can help by encouraging them to have their cholesterol checked as their doctor advises, rather than neglecting it because they feel well, and not to rely on a check from years ago. Encourage them to ask their doctor what their cholesterol and overall cardiovascular risk are and what they mean, and to act on any raised risk through lifestyle, a heart-healthy diet, activity, healthy weight, and not smoking. And, where appropriate, medication, taking any prescribed medication consistently, support the healthy living that improves cholesterol, and keeping up monitoring. Helping a loved one check and act on this quiet, powerful number can catch and address a silent danger before it causes a heart attack or stroke. One of the genuinely impactful things you can do for their heart. So your help getting this silent number checked and acted on genuinely protects them. Let me draw this all together. Your cholesterol, especially the harmful kind feeding into your overall cardiovascular risk, is a quiet but powerful number that a great many people never think to check, precisely because it causes no symptoms. High harmful cholesterol silently contributes to the artery clogging behind most heart attacks and strokes, with no warning, so the only way to know is to check. It's so easily overlooked because it causes no symptoms to prompt checking, because people may have checked it only once long ago, because its importance isn't understood, and because feeling well leads people to skip it. Checking it is a simple blood test, interpreted by your doctor within your overall cardiovascular risk. The value comes from acting on the result. If your harmful cholesterol or overall risk is high, lifestyle measures and, where appropriate, medication genuinely reduce your risk, catching and addressing a silent danger before it causes a crisis. This matters because it's a quiet, powerful, evidence-based way to protect your heart from a danger you couldn't otherwise know about. So approach it by having your cholesterol checked as advised, understanding it and your overall risk, acting on any raised risk through lifestyle and medication, taking any medication consistently, and keeping up monitoring, all in partnership with your doctor. So here's what I'll leave you with. First, understand that your cholesterol, especially the harmful kind, is a quiet but powerful number for your heart, because too much silently contributes to the artery clogging behind heart attacks and strokes with no symptoms, so the only way to know is to check it. Second, recognize why this number is so easily overlooked. Because it causes no symptoms to prompt checking, because you may have checked it only once long ago, because its importance isn't always understood, and because feeling well leads people to skip it, and don't let these lead you to neglect it. Third, have it checked, which is a simple blood test, often part of routine bloods that your doctor interprets within your overall cardiovascular risk, and ask your doctor when and how often is appropriate for you. Fourth, act on the result, since checking only helps if you do. If your harmful cholesterol or overall risk is high, address it through lifestyle, a heart-healthy diet, regular activity, a healthy weight, and not smoking. And, where appropriate for your risk, cholesterol-lowering medication discussed with your doctor and taken consistently, never stopped on your own. And fifth, approach it as a partnership with your doctor, having it checked as advised, understanding your cholesterol and overall risk, acting on any raised risk, and keeping up monitoring. Checking and acting on this quiet, often overlooked number is one of the genuinely powerful, evidence-based things you can do for your heart. Precisely because it catches and addresses a silent danger before it causes a crisis, so it's well worth doing rather than skipping because you feel fine. So take care of yourself. Get this quiet number checked. Understand your overall risk, act on it with your doctor, and keep up monitoring. And because checking and interpreting your cholesterol and managing your risk require a doctor, please treat your cholesterol as a silent but important number to check and act on in partnership with your own physician, rather than neglecting it because you feel fine, and never start, stop, or change cholesterol medication on your own.